I'm Dr. Anthony Kaveh, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist. This is a real-life operating room where I have seen patients, especially the Gen Z population, radically transform in the last 10 years. And it shows under anesthesia, and it has to do with how lonely Gen Z is, because some of these effects show under anesthesia that really demonstrates how powerful the mind-body connection is. 10 years ago, when I was still a bright-eyed and bushy-tailed doctor, I remember talking to patients, and there was some stigma around mental health here in the United States. I trained at Stanford, so I'm in the Bay Area, and we would talk about the mental health and the medications they were taking before surgery, but it was kind of like, you know, I'm on Prozac, I'm trying to get my depression under control. Fast forward 10 years, and there's a very different view towards mental health. It's not that it's bad to be aware of mental health. This is incredibly important because it affects surgery and anesthesia in ways that most patients have no clue about. When you're under anesthesia, connected to the ventilator, when you're on this bed here, your mental health is incredibly important. But nowadays, when I talk to patients before surgery, they're like, oh yeah, I take Prozac for my depression. I'm not saying that Prozac is bad at the right time in the right individual, but notice how different it is. It's like the depression is a part of them. I take it for my depression. I don't want to be overly semantic, but depression has almost become normalized. And in the Gen Z population, they are subject to so many more pressures that make them lonely. Up to 50% of Gen Zers appear to be lonely. And when they come into the operating room, it just blossoms because of the vulnerability, the stresses, and so much more that surgery is bringing up in these young individuals who don't yet have the coping mechanisms to be able to be resilient in light of these acute stressors, the great unknowns, the fears and doubts that surround what happens to your body under anesthesia. So instead of like 10 years ago, I'm taking this to try to get over my depression, I take it because of my depression. Notice the word choice, very powerful, and it has to do in part with how Gen Z is feeling increasingly left out, poorly understood, lacking companionship. And this is a dangerous place to be before life stressors, especially those of anesthesia. Now, this is propofol here, by the way, this white medication. And when patients get varying levels of propofol, a couple of things are exposed. Number one is what medications ordinarily go in their bodies. Gen Zers are more likely to grab for sleep aids when they encounter insomnia. Insomnia is more commonly associated with individuals that are experiencing loneliness, as well as depression, anxiety, substance use disorder, etc. Did you know that when you put sleep aids in your body, and for that matter, marijuana to chill out, or any other drugs that Gen Zers are also increasingly susceptible to taking, this shows under anesthesia. When you're on this table, we need to adjust the doses of anesthesia that we give. Patients that take marijuana every day, I'm not kidding, marijuana, they need up to 2 times as much of this white stuff than individuals that don't take marijuana. They might need more anesthesia gas, like what comes out of the ventilator behind me. Remember, this is anesthesia gas. This is what you're inhaling through the breathing tube. So I had to literally just bring this knob up higher and higher and higher. I got to crank that number up higher and higher. If they're getting laughing gas here, we may need to bring this up higher and higher because their brains are seeing so many other substances because of the other comorbidities of loneliness, depression, generalized anxiety, substance use disorder. These are all very real. They affect the brain not only because of those substances, they increase the body's tolerance. By the way, I should also say the tolerance to medications like this one that I'm holding here called midazolam. This is a powerful, powerful Xanax. Very powerful. Sometimes they need more of this, which is medical grade fentanyl. So not only, you have to understand that when patients are wound up, their central nervous system is on high alert all the time because of chronic loneliness, which is likely to be associated with other mental health conditions. That in and of itself may increase the amount of anesthesia that you need. Now, when you throw in medications to medicate the depression, Prozac, Zoloft, all sorts of SSRIs, SNRIs, tricyclic antidepressants, benzodiazepines if they have concomitant anxiety. Now you're talking about also getting tolerance to other medications, and those have cross tolerance with anesthesia, meaning that the more the Xanax you take at home, the more anesthesia you're going to need in the operating room. Another way that by virtue of how the Gen Zer's body responds to anesthesia, how much of it they need, it's like opening up a book of, my goodness, this poor individual is suffering. Their brain has been rewired in ways that they need so much more anesthesia compared to someone of the same age from a different generation. It's not pre-recorded. Leslie Lane, it's live. This is Dr. Kaveh, live and unscripted, but I just have so many great questions coming in from you guys that it's hard to see them all. Mark Pearson, I didn't see your question, by the way. Kina here raises a very, very good point about alcohol. Alcohol also has incredibly dangerous side effects under anesthesia when it's used for long periods of time, especially if it's used directly before surgery. And we've talked about that in other videos, but we know that lonely individuals are more likely to turn to alcoholism, which can wreak havoc on the body. If you guys appreciate us talking about mental health and how much mental health matters, and if you appreciate me coming on here at the end of a long day in the operating room, do please hit that like button. Your support helps me do this more often to raise awareness for you and also help you learn how you can take control of your body and better advocate for yourself in this broken healthcare system that we live in that allows these types of patient sufferings to go by unrecognized and undertreated. So another thing you need to know about Gen Zers, when they get a little bit of anesthesia, they like their mobile phones or their smartphones. Sometimes if I'm doing a nerve block, like I'm placing the needle in their shoulder area, I haven't seen this before until recently. I have some individuals who stay on their phone while I'm doing the nerve block. A nerve block is where I numb the nerves, for example, for arm surgery, kind of like when you get your teeth and jaw and lips numbed for dental procedures. But instead of the patient looking at me, they're on their phone while I'm doing the procedures, which is very fascinating to me. On one hand, and this has really blown my mind, it's quite unusual to have individuals not in the operating room, but before they come in the operating room, they're on their phones till the last second. This is like those sleep aids, because the smartphone is a distraction. Distractions are powerful before surgery, don't get me wrong. If I'm gonna get a poke in the arm, I wanna be distracted. I don't wanna be in the moment feeling it. But you gotta recognize that the distraction sometimes replaces searching for the root cause of the suffering. Does that make sense? Does that make sense? Anita is asking to answer Mark's question. Mark, your question has gotten buried in the so many comments I've gotten here. Could you please... Oh, you're asking about sleep apnea. Well, Mark, sleep apnea is not as common in Gen Zers yet because of their age. I have other videos specifically on sleep apnea. I don't want to digress too much, but suffice to say, they are more sensitive to opioids. And they're more likely to get Narcan if there's an overdose. So there's lots of considerations for breathing tubes and stuff like that. But you should watch the other videos specifically where we talk about sleep apnea. And we can do another live on it if you'd like as well. Cheryl, Kate, Leslie, everyone, thank you for the kind comments. But we got to talk about the phone though, because the phone is a distraction when individuals are having something done to their body, and instead of recognizing and facing the reality that I'm going to have surgery. It's tempting to just be Insta-chatting or Instagramming, whatever, until the very last minute, even while the needle is going into your shoulder or into your leg. This raises a risk because, like the sleep aid is easy to grab as a distraction from why is someone having insomnia? Why is somebody so anxious that they are ruminating and perseverating in the same inwardly focused thoughts that they can't even get the peace of mind to fall asleep? This is dangerous if we don't recognize that the sleep aid, the pot, the cell phone are all distractions that potentially sabotage Gen Zers from looking at what is the underlying reason for why I'm feeling a certain way. Now, someone's asking, is this just Gen Zers? Debbie, great question. No, it's not just Gen Zers. But the problem is that there are more Gen Zers that are Gen Zers are more likely to grab the sleep aid, to be on their phone, to have the insomnia, to have the loneliness. That is why Gen Zers need to be advocated for, and they need to advocate for themselves and be aware of the effect that distracting from the root cause makes anesthesia worse. Because when you're under anesthesia, not only does it look kind of silly for you to be, or I should say, when you get the first little dose of anesthesia and you're still on your phone, it looks kind of silly, but it is demonstrative of what's going to happen after you wake up. Because if you're distracting yourself without recognizing that, why am I anxious? What are my concerns? Have I asked my doctor what I'm concerned about? Versus suppressing, avoiding, distracting. When you wake up and you don't have that distraction with you, what are young people more likely to do when they wake up from anesthesia? They're on the table here. What are they more likely to do? They are more likely to wake up delirious, kicking and screaming. Yes, that's you, Gen Zers. You might not remember it because your brain is not forming memories after you wake up from general anesthesia. But ask any anesthesiologist, you're more likely to wake up, what we call it is a teenage wake up. The more at least we believe, right? Data is hard to come by in these things. These studies are not difficult. No one really has an incentive because you're not making money off of studying this. But if you want to empower patients, you have to ask the doctors that see patients that are waking up. Are they waking up afraid, in terror, in fear, delirious, emotional? Or are they waking up peaceful? If you fell asleep that distracted with your smartphone, the same way that we have these distractions with sleep aids, you got to be concerned for, are we not addressing the root causes of loneliness and how it associates with depression and anxiety, stress disorders, etc. And I got to say that the effects of anesthesia, and I'm going to just show you the ventilator one more time because some other things happen that can be pretty unusual here. Just the act of putting the mask on someone's face who is so afraid, if they're on their phone directly before coming in the room as a way of distraction instead of facing the fear, right? You have fight, flight, freeze. Flight is distraction. Flight is distraction. With the second they see this and they don't have the distraction present anymore, you have a meltdown. These are how, once again, anybody, but most commonly we're seeing Gen Zers just not be mentally prepared for the stressors of surgery. Valdi asks, are the reactions noted in our chart? Sometimes they are, sometimes they are not. Very good question. So I hope that you all appreciate that Gen Zers have a lot of stresses placed on them that past generations didn't have, the pandemic, etc., but also have more distractions that rob them of this inwardly focused empowerment. They are so entrenched in the fight, flight, or freeze, often the flight, because flight is distracting. And this is hurting Gen Z, and the consequences are we're going to see them more as they get older. If they're already grabbing from alcohol more often than before. Remember, Gen Zers used to look for alcohol alternatives, right? With the pandemic, they've turned to alcohol more than before. Pot, sleep aids. This is going to progress with their age, and I do fear there's going to be serious side effects that will be apparent even outside of anesthesia. Well, they already are because 50% appear to be lonely. So if you know someone who's a Gen Zer out there, please reach your hand out. You might be older, you might be wiser, but engage them with curiosity. If you're a Gen Zer watching this, know that you have an incredible potential to buck the trend, because I have seen patients in their late teens and early 20s, right? Prime Gen Z, even like mid-20s, and they, every once in a while, I kid you not, this is the favorite part of my job, for those of you who ask. One of my favorite parts of this job are seeing the Gen Zers who wake up, no joke, they fall asleep zen, cool, and they wake up grateful and thanking everyone. And I see it, 1 in 10. They are so relaxed. They have the wisdom of that, Jedi master out in the Himalayas meditating on the mountains. They're out there. Being a Gen Zer doesn't mean that you can't do this, but it means that you need to be aware of the forces of distraction that can torpedo your mental health and what happens to you in stressful situations. But I know you can do it. I've seen it happen so many times, and I love to be surprised by that wise Gen Zer. Okay, Kent, I don't know what's going on with your comments, but you got to cut it out. And gentle spirit, I appreciate your kind words there. So remember, you have more power over your health than you've ever been told. And I hope that if you learn something, you'll share it with others to help empower them to advocate for themselves. And you can always leave a comment before to ask about future topics for live streams. The Gen Zers, like Small is asking, as of right now, they're like the 18 to 24s. They're born after 95, so they're actually more than 20 now, but 95 and beyond, there is this very sharp difference in the patients that are coming in for surgery. So if you know a Gen Zer, or if you are one, advocate for yourself or help them advocate for themselves. Let's answer some questions. And let's see. Leonie, thank you for clearing this all up. My pleasure. Let's see. Lisa, thank you for your inspirational comment there. Wild Tiger, I can't answer any specific questions over social media. Christina, are the things that happen under anesthesia documented in records? Sometimes they are. Sometimes they're not, because some anesthesia records don't include these types of details, especially if they're preoccupied with the life and death procedures like blood transfusions, airway emergencies, traumas, etc. It might not always make its way into the chart, so it's not always apparent, but you can always talk to your anesthesiologist to ask them. Watkins says, Watkins says Kent is jelly. I wonder what jelly stands for. Jealous? Michelle, good to see you. Does grief affect anesthesia? Grief can lead to depression and other mental health conditions, but it's not as tightly associated because grief is often temporary. Bereavement is, by definition, something that's short-lived versus major depression that might come from grief if it's unaddressed for long periods of time. Leslie says, is there a place to ask questions that don't pertain to Gen Z? Leslie, yes, come on a different live. We'd be happy to talk about it. All right. By the way, Alexis, very good to see you. Docty says, being taught your whole life that you are a loser, if you don't have oodles of friends or a partner by middle age, doesn't help. We aren't taught to be self-approving. Docty, you always have lots of wise words. Mel says, I just had surgery 3 weeks ago and I woke up at the end and could feel my doctor stitching me up. Pain, not just pressure. I'm sorry that you had that, Mel. I would like to know where that surgery happened and if you're able to find out why that happened. And yes, Mark, I do practice in the San Francisco Bay Area. All right. Sorry, teaches 8th grade. There are some who are getting high at school daily. It breaks my heart. The need to escape through substances. Yes, I'm so sorry, Mary, but you've nailed it. Fight, flight, or freeze. And younger people, quite frankly, everyone. But young individuals appear more presented with opportunities to flee through drugs, the cheap back door, to having short-lived states of peace and calm. That's the risk that Gen Zers face because it's just so much more available than ever before. And oftentimes suffering is normalized, which breaks my heart. I'm all about advocating, not normalizing suffering. It's a very important distinction. And Pinch says the loneliness is only going to get worse with total social isolation. Okay, well, it will get worse, I'm sure, for many different reasons. Butterfly wants me to do a show without holding the needle with the milk of amnesia. I've done it many times, Butterfly. I've done it many times. All right. Okay, so let's look at some newer comments. James, thank you for the kind comments. I really appreciate that. Eebs has woken up several times. I have a genetic connective tissue disorder. Is it EDS? Are we talking about Ehlers-Danlos syndrome? Let me know, EHBS. Alethiometer. I'm confused. I feel like because I have issues and have been asking for a week to talk to the doctor, I was told I would meet them when I got into the OR. Did you not meet them, Aleth? I hope you did. Jakey says, hard? Well, you have to be honest with your doctor, always, and especially the anesthesiologist. Jakey Bakey, you're right. Mel is in Canada. Oh my gosh, I'm so sorry you've had so many surgeries, but you're right. Typically, intravenous anesthetics like propofol appear to be gentler. There's no hard evidence for this, but usually you get more propofol for sedation cases versus general anesthesia cases. And the less intensive the surgery, the less groggy you'll be when you wake up. So that might be another explanation for why. Brian says, is there a special anesthetic for pediatrics or the same as adults, but just less? Brian, the medications tend to be the same. The doses are much different. Sometimes the equipment is different as well. Very good. Tragically Delicious says, Gen X says, what's up? I love it. I love it. Adderall shortage needs to be addressed by Congress. Yes, Sam, that along with many other medication shortages and doctor shortages and nurse shortages. You're right. Gen Z and baby boomers are lonely, says Wild Tiger, and they are correct. And I'm so happy to hear that Leslie, after her April 28th surgery, has been opiate free. I hope that your pain is under control, Leslie. You know, it's great to be opioid free, but not at the expense of having untreated pain. Pain needs to be treated. That's the issue with the pendulum that we talked about how doctors aren't prescribing opioid medications. You can't undertreat pain, just like how you can't undertreat depression. You have to use the medications at the right time in the right place. I hope that your recovery is going well, and I hope everyone here is sending you positive vibes for that. It is a systemic failure. You're absolutely right, says the comment from the person who has non-English name there. Interesting. Yes, you are correct. It is a systemic failure. Belinda, good to see you. Can benzodiazepines make me resistant, asks Hardwell. Yes, the more benzos you use at home, the more benzos and other anesthetics you'll need in the operating room. Christina had a tonsillectomy at Stanford, and they woke up upset. Nurses are mean. No one would tell me what happened. I'm sorry that you had that experience, Christina, but I hope that you feel empowered to advocate for yourself in the future if you need surgery again. Becca says, please answer. As really interested. Okay. I had knee surgery 12 days ago. I woke up in pain in recovery. I had a block and general anesthesia. Why did I still wake up in pain? Well, nerve blocks don't block all of the pain. They block part of the nerves that go to the area where the surgery is. Often, the nerve blocks for knee surgery are incomplete, which is why there is still often some residual pain. However, the question to you is, when you woke up, over the rest of the day, did the pain get worse? Because if the pain got worse, it meant that the nerve block was probably covering a lot of the pain. Then when it wore off, that pain came on, or those nerves came online to allow for perceiving the pain. Good question. Carol asks, do you think Gen Z is lonely? Lonelier than baby boomers? It's difficult to know for sure, but it is alarming for their age. Usually young adulthood is not associated with such levels of loneliness as the elderly whose friends and family are no longer with them. So that trend and that comparison is the concerning. And Mel, I agree that the Gen Z population are definitely lonely. Anita, good to see you on here. And yes, the human body is amazing, Mel, you're right. Hannah, I unfortunately can't give you any specific medical advice about your SVT, but I do encourage you to speak with your physicians about that. Redheads have 25% more nerve endings. Well, we'll end it with this. The red hair gene mutation in the melanocortin-1 gene appears to increase the amount of sevoflurane anesthesia that you need, this yellow labeled anesthesia gas, but not necessarily more propofol. Very good question. Redheads do appear to be a little different. You know, when I talk about patients who are coming in the operating room, it's always 4 types of patients: the fighters, the criers, the redheads, and the Jedi Masters. Those are the 4 types, and redheads get their own category. A little bit as a joke, but also because there are some differences that sometimes we see, but science still has a lot more to teach us about it. So remember, you have more power over your health than you've ever been told. If you're lonely, or if you're not lonely, feel empowered to either help someone who is lonely or to reach out for help. Please don't hesitate to reach out for help so that you can uncover your inner healing potential, which might be hard to appreciate when we're feeling the depression, anxiety, and other stressors from loneliness. Until next time.